Leaders at AHS know too well the overwhelming feeling of managing multiple issues and having to interpret large amounts of information and data. Examining measures or data using the appropriate graph, or what we like to call making meaning from evidence, can help you zero in on the key issues and begin to prioritize and analyze information so you can kickstart improvements and improve patient safety. A scatter plot diagram is a good tool to graphically represent the relationship between two variables. Scatter plot diagrams help you identify and understand cause and effect relationships, or how one variable is affected by another. Here's the scatter plot, and it is used to display pair data. The x-axis displays a suspected influence of the y-axis, which is generally the result. Both factors must be either continuous or count-type data. A data point represents two factors for a single observation or item. In this example, we have hand washing compliance rate on the x-axis because it is a suspected influence of infection rates, which is on the y-axis. Another value you may see on the scatter plot is the R-squared calculation. R-squared is the percentage which describes the variation in the data represented by a linear model. The closer the data points are to this line, the higher the value. A scatter plot uses patterns to make conclusions about a particular situation and how the two factors may be related, or the term more commonly used, correlated. Examining and analyzing these patterns helps to understand different types of relationships or correlations, which can be used to create and test a hypothesis. A hypothesis is an idea or theory that is not proven but leads to further study or discussion. A negative correlation indicates a negative association with the variables or factors, such as the more we partner with patients, the lower the number of adverse events occur. A positive correlation indicates a positive association with the variables, such as the longer period of time a person smokes, the higher the risk of respiratory disease. A curvilinear correlation indicates the rates of change of the variables is not constant. For example, after reaching a specific dose of vitamin C, the body can no longer absorb it, and there is no additional health benefits. No correlation indicates there is no relationship between the two factors. As an example, there is no correlation between breast size and the ability to produce breast milk. Looking once again at our example, we see how the infection rate and the hand washing compliance rate is related to one another. Based on this, you might suggest that as the hand washing compliance rate increases, the infection rate decreases. And building on this inference, you might hypothesize that if staff wash their hands correctly and consistently between patients, then infections are less likely to spread and the infection rate would go down. But a word of caution. When you do see a meaningful pattern or correlation, it does not mean that the cause is directly related or correct. But it can help to logically create or confirm a hypothesis, which leads to further research and exploration of this relationship. Here is a scatter plot you may encounter as it relates to the VTE prophylaxis. VTE, or venous thromboembolism, is one of the most common and preventable complications of hospitalization, and the VTE prophylaxis is a required organizational practice. What can you conclude about the relationship between the percentage of patients receiving the appropriate VTE prophylaxis and the rate of VTE? How might you describe the correlation? Did you say the higher the percentage of patients that receive the appropriate VTE prophylaxis, the lower the rate of VTE? And did you describe it as a negative correlation? A scatter plot diagram is a good tool to graphically represent the relationship between two variables. But remember, it's only one way to understand a possible cause and effect relationship, and further research and exploration must be taken in order to make a meaningful conclusion. In addition, it can be one of the many tools used in the build understanding step when using the AIW method for improvement. In AHS, leaders are able to access data for a specific area or project through a number of sources, such as RLS, FACT, Statit, and Tableau. If you require assistance using these or require additional support, AHS Clinical Quality Metrics is a great resource to support the design and development of measures and strategies to help clinical teams obtain and use data to improve quality. Also, process improvement and clinical quality improvement collaborate with staff, medical staff, and patients to improve clinical processes provincially and within each zone. All of these groups can be found on Insight. Good luck making meaning from evidence.